Plantar fasciitis is commonly described as pain in the mid part of the foot or the heel that is usually worse in the morning upon rising with your first few steps. The pain and discomfort gradually subsides as you walk, but instantly returns again when standing after rest. Plantar fasciitis is a very common problem, and most of the time it occurs because of repetitive injuries on your fascia, which is a type of ligament-like tissue in your heel. Many things can cause injuries to your plantar fascia, things like strenuous exercises or working on hard surfaces. Being over 40 greatly increases your chance of developing plantar fasciitis as the fascia weakens with age. If you are a woman, you have a greater risk of developing plantar fasciitis. Other risk factors include obesity, work posture, and high-impact exercises like running or ballet dancing. Traditional treatments for plantar fasciitis have included ice, stretching, cortisone injections, night splints, rest, and physical therapy. When these approaches don't work, then extracorporeal shockwave therapy, or ESWT, is an excellent, safe, and effective alternative to plantar fascia surgery. Surgical procedures can be very expensive, especially if a patient has a high deductible or poor healthcare coverage. In this office, we are proud to provide ESWT as a new and exciting approach to resolving plantar fasciitis. The benefits of extracorporeal shockwave treatment for plantar fasciitis are broad and profound. ESWT seems to work along many different pathways to facilitate healthy and complete healing, and it is approved by the FDA for the treatment of plantar fasciitis. A typical ESWT plantar fasciitis treatment takes about 20 minutes and starts with the area of pain being identified by the patient and usually confirmed with imaging. You'll be comfortably positioned on a treatment table, and a conduction gel will be applied to the bottom of your foot. Shock or pulse waves are then released from the device applicator and travel into the sole of your foot. Shockwave therapy relieves pain and provides a short recovery period with very few risks or side effects. Most patients resume normal activity immediately following treatment. Extracorporeal shockwave therapy is a non-surgical, non-invasive method that delivers high-energy acoustic or sound waves to a targeted area in order to treat various musculoskeletal conditions, including plantar fasciitis. ESWT works in 3 ways. Desensitization. Local anesthesia is not required because ESWT is very powerful, and the targeted area will become increasingly desensitized throughout the procedure. Number 2. ESWT turns a chronic injury into an acute injury. Chronic injuries occur from overuse of an area of the body over an extended period of time and can be very difficult to resolve. Plantar fasciitis is an example of a chronic injury that is changed into a much easier to treat acute injury using ESWT. Number 3, vascularization. During the ESWT procedure, microscopic and controlled injuries are induced. These injuries jumpstart the overall healing process by promoting the growth of new blood vessels in the tendon and fascia. This is called vascularization, giving your body the tools it needs to heal naturally. Shockwave therapy is thought to work by inducing microtrauma to the tissue that is affected by these problems. This microtrauma initiates a new effective healing response by the body. Shockwave sounds scary, but it's definitely not. Will it cause pain? It depends. You may feel discomfort to begin with, but as the treatment is delivered, your body will get used to it. The doctor or therapist will ask for your constant feedback during the treatment and will adjust the intensity accordingly. Shockwave therapy also creates an analgesic effect, and many patients report an immediate relief following shockwave treatment from the pain caused by their chronic conditions. We will be happy to answer any questions you may have about ESWT, and thanks for watching.